Our today's topic is Introduction of Angiology and Pericardium. The contents are angiology, blood vascular system, anastomosis, structure of artery, and pericardium. Now, first, what is angiology? Angiology is the branch of the systemic anatomy which deals with the study of cardiovascular and lymphatic system. Blood vascular system consists of arteries and veins. The artery carry the blood to all the parts of the body and they divide into arterioles, which further divide into the capillaries. Capillaries are the microscopic tubes. The arterial capillaries, they unite and they form then venous capillaries. Venous capillaries then form venules. The venules then form veins. The veins they finally open into the vena cava and vena cava they return blood to the heart. Now the arteries. The arteries are the tubes which carry the blood from the heart to the various organs of the body. So arteries are pulmonary artery and systemic arteries. The pulmonary artery arises from the right ventricle and it carries the blood to the heart for purification. So after the purification of the blood from the lungs, the blood returns to the heart via the pulmonary veins into the right atrium. And the circulation of the blood from the right ventricle to the lungs and then back to the heart, it is known as pulmonary circulation. Now the systemic arteries, they arise from the aorta and they carry the blood to the different parts of the body. Collateral branches, the branches which arise from an artery at varying intervals along its course, they are known as collateral branches. While as the terminal branches, these are the branches which result due to the division of an artery at the point of termination during its course. Now, anastomosis. The branches of the adjacent arteries they communicate with each other and form anastomosis. The anastomosis are of three types: anastomosis by convergence, anastomosis by arches, anastomosis by transverse communication. Anastomosis by convergence. When the two blood vessels they converge and unite with each other at the point of their termination, it's called as anastomosis by convergence. Anastomosis by arches. When two blood vessels are directed towards each other and they unite to form a single curved tube, it is known as anastomosis by arches. Anastomosis by transverse communication. When transverse branch connects two adjacent parallel arteries, it's called as anastomosis by transverse communication. Now coming to the structure of artery. The artery consists of three layers: tunica intima, tunica media, and the outermost layer is tunica adventitia or tunica externa. The tunica intima, it consists of a simple squamous epithelial layer which is known as endothelium, and then a delicate layer of connective tissue known as basement membrane and internal elastic lamina which is made of elastic fibers. Then the next layer is tunica media. The tunica media consists of the smooth muscle cells with varying amount of collagen and elastic fibers. The elastic fibers condense and they form external elastic lamina. Now the tunica adventitia or tunica externa, it is the outermost layer which is made of connective tissue. So in the diagram, it is The innermost layer, tunica intima or tunica interna, there is simple squamous epithelial lining, that is endothelium. Then there's a base membrane and internal elastic lamina. And tunica media, it is made of smooth muscle cells and external elastic lamina is there. And the outermost layer that is made of connective tissue, it is known as tunica externa. Now the veins consist of the same three layers: tunica intima, tunica media, and tunica adventitia. And the main difference between the veins and the arteries, they are that the veins, they have the valves. The valves are formed by the tunica intima and they prevent the backflow of the blood. And the tunica media in the veins is thin as compared to that of arteries. Now there is a term known as vasa vasorum. The vasa vasorum is when the wall of the arteries and the veins, when they are supplied with blood by a large number of small arteries, these small arteries, they are known as vasa vasorum. Now coming to the pericardium. The pericardium is a fibroserous sac that completely encloses the heart and the blood vessels that enter and leave the heart. Its form is similar to that of the heart and it consists of two layers: the fibrous layer and the serous layer. The fibrous layer, it is the outermost layer, and the inner layer is the serous layer, which is further divided into parietal and the visceral layer. Between the parietal and the visceral layer, there is a capillary space that is known as pericardial cavity, which is filled with a serous fluid known as liquor pericardial. This pericardicosternal ligaments. The pericardium is attached with the sternum in case of the cattle by the two ligaments. They are known as pericardicosternal ligaments. Here in the diagram you can see the pericardicosternal ligaments which attach the pericardium with the dorsal surface of the sternum in case of the cattle, and this is the outer layer that is known as pericardium, which encloses the heart as well as the blood vessels that enter and leave the heart. So the pericardium, it is covered externally by mediastinal pleura and is crossed at its upper part by phrenic nerve. The later faces are chiefly related to the lungs, but at the lower part it is in partial contact with chest wall. So here you can see this is the mediastinal pleura, then the fibrous layer of the pericardium and the parietal layer. These all the three layers, they are fused, and between the visceral and the parietal layer, this is the pericardial cavity. The visceral layer of the serous pericardium is known as epicardium. Now on the left side, the area of contact, it extends from the third intercostal space to the fourth, and on the right side it is limited or it is absent. In case of the horse, the pericardium at the apex is attached at the posterior half of the dorsal surface of the sternum. And on the left side, the area of the contact, it extends from third rib to the sixth intercostal space, and on the right side, the area of the contact extends from third intercostal space to the fifth rib. Now in case of the dog, the pericardium is attached to the sternal part of the diaphragm by a fibrous band which is known as pericardicophrenic ligament, and is connected to the sternum only by mediastinal pleura. The area of contact is chiefly ventral. Now in case of the fowl, the pericardium is thin and membranous. It is related to the lobes of the liver laterally, sternum below, and trachea and esophagus dorsally. Thank you.